in our economy. And I think it's pretty evident that the middle class in particular is being crushed by the president's policies, and Obamacare is certainly no exception. Yesterday, we saw in Forbes magazine, Avik Roy reported on a recent study that was done by the Manhattan Institute that Obamacare will increase insurance rates for younger men by an average of 97 to 99%, and for younger women by an average of 55 to 62%. Well, in my home state of South Dakota, that is more than just a statistic. It is a grim reality facing thousands of young men and women. By comparing a typical low-cost plan for a healthy 30-year-old in South Dakota this year with a bronze plan in South Dakota's health care exchange next year, the premium increases, Mr. President, are staggering. Younger women are going to face a 223% premium increase, and younger men are going to face a 393% premium increase when you compare new data from the Health and Human Services Department with data that came out from the Government Accountability Office about premiums in my state just this year earlier in January. So for those millennials in South Dakota, that's a $1,500 increase in health care premiums each year for women, and more than a $2,000 increase in health care premiums for men. So the money that could be used, for other things is now going to be going toward this increase in health insurance premiums that people are going to have to pay to get covered. So they could have been using that to pay off a student loan. They could have been using it to save for a home or to start a family. And so this has a tremendous impact on the economy, and particularly those who are going to get hardest. In my state of South Dakota, not unlike other states around the country, it's young people, younger men and younger women. Now, interestingly enough, the administration and the president are out talking about how the HHS study or report confirms what they've been saying, that somehow premiums are going to go down. Well, the reason they are saying that, Mr. President, is they are comparing the exchange premiums, what they think people are going to pay, with what CBO, the Congressional Budget Office, predicted they might pay earlier this year. And so it's a hypothetical, it's a mythical comparison. There's nothing to it. It's fiction, if you will.